Guillain-Barre syndrome, GBS, also called Polyradiculoneuritis. Guillain-Barre syndrome, GBS, is an acute, rapidly progressing, inflammatory, demyelinating polyneuropathy of the peripheral sensory and motor nerves and nerve roots. GBS is most often but not always characterized by muscular weakness and mild distal sensory loss. GBS is the most frequently acquired demyelinating neuropathy. It affects 1 in 100,000 people and must be identified quickly to initiate treatment and decrease life-threatening complications. Mortality rate is about 5% despite intensive medical care. Pathophysiology and etiology: believed to be an autoimmune disorder that causes acute neuromuscular paralysis. Viral infection, immunization, or other event may trigger the autoimmune response. About 30% to 40% of cases are preceded by Campylobacter infection, an acute infectious diarrheal illness. Cell-mediated immune reaction is aimed at peripheral nerves, causing demyelination and possibly axonal degeneration. Clinical manifestation: paresthesias, acute onset of symmetric progressive muscle weakness, most often beginning in the legs and ascending to involve the trunk, upper extremities, and facial muscles. Paralysis may develop. Difficulty with swallowing, speech, and chewing due to cranial nerve involvement. Decreased or absent deep tendon reflexes, position and vibratory perception. Autonomic dysfunction: increased heart rate and postural hypotension. Decreased vital capacity, depth of respirations and breath sounds. Occasionally spasm and fasciculations of muscles. Maybe dysthesias and muscle spasms. Diagnostic evaluation: CNS examination, low blood cell count, high protein. Electrophysiologic studies: NCT shows decreased conduction velocity of peripheral nerves. Management: plasmapheresis produces temporary reduction of circulating antibodies. Electrocardiography monitoring and treatment of cardiac dysarrhythmias. Analgesics and muscle relaxants are needed. Intubation and mechanical ventilation if necessary. Paralysis develops. Respiratory paralysis develops. Complications: respiratory failure, cardiac dysarrhythmias, complications of immobility and paralysis, anxiety and depression. Nursing assessment: assess pain level due to muscle spasm and paresthesias. Assess cardiac function including orthostatic blood pressures. Assess respiratory status closely to determine hypoventilation due to weakness. Perform cranial nerve assessment, especially 9th cranial nerve for gag reflex. Assess motor strength. The nursing interventions must include maintaining respiration, avoiding complications of immobility, promoting adequate nutrition, maintaining communication and relieving pain, and reducing the anxiety. The outcome-based evaluation: respirations 24 per minute, deep and unlabored. Providing assistive range of motion exercises every 2 hours. No pressure sores or edema present. Gag reflex present. Eating small meals without aspiration. Using short phrases and head nodding to communicate effectively. Patient verbalizes decreased pain. Patient verbalizes reduced anxiety. Thank you.